The shooting in Newtown, Connecticut earlier this month has spurred a number of discussions throughout the country, but here on Guam, community leaders are shifting the focus to the needs of individuals with disabilities and the needs of their families. Senator Aileen Yamashita held a roundtable discussion at the legislature today, allowing families to speak out about the realities of mental health challenges and for island leaders and service providers to talk about how to better support persons with disabilities. Guam Cedars Training Associate Dr. Nevis Flores said that the prevention of violent acts begins with treating all persons as good, no matter what their condition.
But we have to believe that every child is born good. They are born for some reason on this world. Even the killer, the shooter of Newtown, or the old guy who burned his house and then shot the firemen and killed two, shot 4 firemen and killed 2 yesterday, I think, or the Christmas Eve in New York. Even those people, are God's children, and I think we need to believe that we need to help them as well before this happens.
Gumamami Director Bernie Grayjack emphasized the importance of removing the stigma behind mental illness, especially with the attention the shooting at Sandy Hook Elementary School has brought to illnesses such as Asperger's syndrome.
Treatment is really key to reducing violence. We all know that. All of us who work with individuals with serious mental illness know that. So if we are in treatment and receive the appropriate treatment, not just the medication and which is nice, but all the other things that go along with it, family support and all our community support, we are no more violent than the rest of you in this community.
The gaps in services available here on Guam were also a big part of today's discussion, with Department of Youth Affairs psychologist Dr. Juan Warpadas pointing out that the kids that end up being confined at DYA might actually be lucky because they end up getting treatment.
We're like a mental health inpatient ward because many of our folks have a crime, a delinquent crime, and they're taking psychotropic meds. We have excellent psychological evaluation and counseling and referral system. Our best thing that we do is crisis. Our social workers and case workers, they can get calls at 2 in the morning for our kids, and we'll go there and we will help them, try to prevent them from going back into the system as a violation or otherwise.
Today's roundtable was called by the Legislative Subcommittee for Sustaining Appropriate and Fair Environments, or SAFE, that's led by Senator Yamashita. Yamashita says that there will be more discussions like this in the coming weeks. Betsy Brown, PNC News.